Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Nurse Rosa Hart, and today my guest is Robin Goldsmith. Thank you so much
Rosa,
for being
great to be here. Yeah.
You're a fellow podcast host.
I am.
So I've been really looking forward to talking to you in person after listening to your voice so much. And you are so good at asking insightful questions to your guests and really spotlighting the innovative work that they're doing in healthcare.
Yep.
So did you start the Healthcare on Air podcast for Verizon, or did you pick that up from someone else?
I did. No, that's great. And thank you, Rosa, for having me. It's I love your podcast too. I think sharing a point of view and a voice specific to a lot of what you talk about with stroke and survivorship is really important. Yeah. But no, I have to credit Leah Sims, my old friend, who was our kind of marketing practice lead that started the podcast and did an amazing job. And when she was leaving and getting another awesome job, she kind of said, "Hey, do you want to do this?" And I was like, I've been on the other side of the table like I'm now. Mm-hmm. But as you know, like moderating a podcast is not the same. And it was, but I dove in. I've been doing it a year and a half. So it's been really fun. Yeah, talking to folks. And it's, I feel really lucky to have kind of the opportunity to do it.
So you were a little nervous and had some apprehension about it.
Yeah, it's always a little nerve-wracking when you're trying something new.
Right, but, I feel more not at ease when I'm a guest than when I'm a host, right? Because you don't know for sure what are they going to ask you. Right?
Yeah, I think I'm feeling the same right now.
Right, exactly. And so I'd much rather host a conversation.
Yeah. You control it.
Right. You would think so. Yeah. But like I said, you do ask really insightful questions, and you've talked to so many people and had all these incredible conversations to know what's going on out there in healthcare and really amplify voices of people who might be starting smaller, new things that haven't made it mainstream yet. Yep. And so I love in podcasting forming those relationships with people so then you can introduce them to people they can partner with, right?
Yeah.
And so I think I've seen you do that already. And that is such an important role that I feel like podcasters play in letting people know who they need to know about. I think iCheck really stood out to me as an incredible kiosk option for vision screening.
Yeah.
Like I would never have known about that because it's not in my local Walgreens yet that I'm aware of.
Hopefully it will be. Yeah, that's a great point. I mean, there's so many people, and I always say I'm optimistic about healthcare, and even though there's so much, there's a lot of challenges, as we know, but like there's so many people that are coming up with incredible solutions and just getting shining a light on what they're doing to really change healthcare for the better for all of us. Like iCheck, Rashid Ali, two, retinal surgeon and Ali, ophthalmologist, but just rock star eye doctors who in their day-to-day practice saw people coming in who were going blind, like really late stage diabetic retinopathy. And this is preventable blindness.
Like 90% preventable if it's caught earlier and you can take those interventions. The same interventions, by the way, that prevent stroke.
Yeah.
It's really all connected, you guys.
Yeah.
So,
but they saw, and this is kind of like the thing I see with all these companies that they bootstrap it and they through their own experiences of seeing something like, man, these guys saw people going blind and they were like, I can't do anything. But if I found it earlier, I could have done something. That's the trend of these people who start these companies.
Yeah.
They just want to change it. And they're like, this needs to change because I see it. And shining a light on those companies, that's why I love doing this.
Right. It makes you feel like you're making a difference beyond your job description, beyond the limitations that are in maybe your authority to directly command, but we can influence in that way by sharing information. So
100%.
So excited about that. As you mentioned about vision, 90% of strokes also are preventable. And because of that, many high-risk individuals, especially in rural areas, lack access to consistent follow-up care.
Yep.
As you alluded to, I host the Stronger After Stroke podcast, and I, as a nurse navigator, have spoken with thousands of people after having stroke who all of a sudden now understand the importance of monitoring their blood pressure at home, monitoring their blood sugar at home so they can make those changes and know what's working for them, because it's actually not a one size fit all for everyone. Maybe they start on a new medication and it's not having effect it needs to get them into the safe zone.
Yep.
And so I'm really excited about digital therapeutic options on the home monitoring space and all the different companies that are working to address that. So what have you encountered lately in your work that you've seen entering into that space?
Yeah, I mean, I think at Verizon, so I'm focused on innovation and strategy, and I'm very privileged to work with our big customers that are, either they're health systems, hospitals, med device, pharmaceutical customers. No matter who it is, I think everyone wants to, build kind of this infrastructure that can handle, give folks reliable and secure connectivity. So I'm like, the two big focus areas for me and my team are like this next generation hospital that will be able to enable a lot of AI and all these use cases that we hear a lot about. But then equally important is the home. And so we all know in COVID, patients were triaged to the home because of lack of capacity. But now the data shows clearly people want to be in their home.
Yeah.
And if we can give them, like you said, devices that can, take away that, okay, I go to my doctor once or twice a year and that's a snapshot of time, but the 99% of the rest of the time they're in their home or on the go. If we can capture that data and give them to nurses and docs like you, just to give this kind of more consistent, always on view of their health, we can detect things earlier. And that's a huge win. And we can do it. There's all these devices we can now capture. I mean, you're wearing an Oura ring.
Well, actually, I'm wearing the Ultra Human ring, which is also in Verizon stores.
There you go.
It does a great job with sleep monitoring. And so I've been able to learn about like stress. It can kind of detect when you're starting to have fever symptoms with like your heart rate and your temperature. It's incredible.
Yeah.
But yeah, things like that, new devices, because like I couldn't sleep in the armband based devices because of how I sleep on my side.
Yeah, I'm a side sleeper too.
Right. But the ring, I can sleep in the ring.
Yeah.
But yeah, it's really great to not just give doctors and nurses, the medical providers, that data, but to give people that personal connection to their own bodies. Because I was talking to one neurologist who said he was really frustrated with all this emphasis on devices because he's like, I think people need to be more in tune with their own body. But honestly, we are so far removed from our own body sometimes. Yeah. And I feel like this device, for example, helps me be more aware and realize maybe it's not all in my head, it's all over my body.
Yeah.
So
I love that point. I mean, it's this idea of like the quantified self. And I think we complicate this. And I think that's where a lot of technology companies, all good intentions, but they throw technology. They don't really understand like the nurse workflow or like how patients are interacting. If we could get to a point where it's easier to have that technology and it for the patients as well as the care teams, but really the patients to invest in their own healthcare journey, make that like get them excited about it, gamify it, like all the rings. I love it. I mean, it's easy. They got a cool user interface. If we can just add to that. And I think we're going to see more and more like through rings, wearables. Ultimately, this will be like subcutaneous, like or clothing that's measuring all kinds
like
of.
Like the continuous glucose monitors.
Yeah.
Those are so powerful in helping people head off. And we're all pretty much predisposed in our standard American diet to have higher blood sugars. And one of the biggest indicators you can look for with prediabetes is actually high blood pressure. It's all connected in our cardiometabolic system. And so things like just monitoring your blood pressure could even alert you that you need to look at more serious things like, are you becoming insulin resistant in your own body?
Diabetes, we all know it's an epidemic. And I think there's a lot of work being done to get that data from CGMs and other devices to just predict, have better analytics about that. A friend of mine who's an amazing leader of a healthcare system, wonderful man, he had a stroke but he got forewarning through a CGM and like the impact. And now he's like such a huge proponent. He's like, cause I could have, as you know, better than anybody, like timing with strokes is essential. And if you have that, alert or just warning.
Do you know what alerted him through his continuous glucose?
It's a good question. He's a seasoned doc, so I think he was just measuring, and maybe it was.
So blood sugar shifts can cause a stroke mimic response where you're having stroke-like symptoms, but it's due to a dramatic fluctuation in sugar. So anytime, if you call 911 for the first sign of stroke, yes, you should do that. Don't wait for permission. Balance change, vision change, facial drooping, arm weakness, speech change, any of those could appear with a sudden change in blood sugar. So it might have been, I don't know his situation. My assumption would be, if he was experiencing those symptoms and went to check and see if his sugar was causing it. And when he saw it wasn't causing it, then he was like, oh, I need help. This is not something I can handle at home.
Okay.
So thank you for giving me one more opportunity to do stroke awareness messaging.
Well, you know, when we first met, my mom was impacted by a stroke. So like, this is like something that I, you know, pretty passionate about because I saw the devastating impacts that it has. And like, so, I mean, like all of us, well, I mean, healthcare is why it's special and unique because everyone's affected by the bad stuff that can happen. So like, I'm super passionate about this stuff because I've experienced it directly through myself, my own care journey, but also loved ones who have, if things were different, if like the things we were talking about now, if they'd been in place, maybe there would have been warning and it would have had a different outcome.
Exactly. Well, and a lot has changed in stroke care since 1995. We have been able to use thrombolytics, which is IV medication, to break up clots in people's brains and restore function. But the result of that is, while stroke is no longer one of necessarily as likely to kill you because we can treat it in that way, it's the #1 leading cause of disability in the world. And that affects that person's quality of life as well as their entire family, maybe even their community. And I think that's what you were alluding to with your family experience, right?
100%.
The disability you live with after and the ripple effects on the whole family. So thank you for sharing your story.
No, happy to.
So we have stroke recovery options like through rehab at home, through like telemedicine, but also recordings like the Stronger After Stroke podcast where you can learn from. So I'm very thankful for Verizon connectivity to empower that in some areas.
Appreciate that.
Is there anything you know of that you've heard of that could do more to empower access for home rehab?
You know, I think there's some interesting things happen. Like in our, you know, for example, we've got this incredible company called Proto. We're showcasing it in our booth. Proto is, imagine they've got some great founders. You might come by and I don't know how much I can disclose or who their founders are, but there's celebrities. Howie Mandel is one of the founders of it. So just imagine what current state of telemedicine now, right? You're on a flat screen with you're my doctor and I'm your patient. I'm seeing that flat screen. Hopefully the connectivity is good. Not always. Rural, probably not. Wi-Fi challenges for older folks remembering passwords. There's a big push and I think the good news is with satellite and our investments in the connectivity infrastructure, it takes a while to get it everywhere. And it's still a challenge, but we've made a lot of strides there. So I think couple things. The investments Verizon's made recently will have the most impact in rural and places where there's access is a challenge. So rural, tribal areas, all those places.
Montana.
Even like I was just talking to someone in Massachusetts, like she has a farm and there's big dead spots.
Whoa.
So I
don't think of the Northeast when I think dead zone.
Oh, no. It's anywhere you go outside of a major metro. Pretty quick, within an hour, you'd be shocked. It gets rural real quick. And you would not even know you're in New York, for example. It could be Kentucky where you're from or Tennessee, similar dynamics. But back to Proto. So imagine a box, 3-dimensional imagery box and it has different form factors. It could be on a stand on a table, like a 2.5 feet tall. It could be 7 feet tall. Imagine you have the ability to bring in a neurologist if you're doing stroke recovery, or physical
Yeah.
therapist, to have
Yeah.
a fully three-dimensional, high fidelity Rosa in all her, the full 360 in your home to give you instruction, make it really personable versus this flat screen.
Like a Princess Leia effect.
Yeah, it's pretty much.
Full hologram.
And that's not like,
Yeah.
that's not that far fetched. I mean,
Right.
that's coming really quickly. I mean,
Wow.
Proto is just that hologram is in a box. So I think the box eventually will go away. So this is not like, I always reference movies like Minority Report and all these things. They're now reality.
Yeah.
Ready Player One, the metaverse, all these things are now, they're real.
If you can conceive it, you can achieve it, right?
That's right.
Which brings us to the billion-dollar question that you can conceive of. So,
Yeah.
Robin, if you were given a grant for $1 billion, how would you like to see it used to meet the needs that you see strategically in order to have the most sustainable impact?
Yeah, I love this question. And maybe I get 10 billion, but whatever the number is.
We'll start with one because you have to be efficient with it.
That's true. That's true.
And prioritize.
I think it's kind of what we've been talking about. I think
Yeah.
if we can give access is such a challenge. People have to drive 100 miles to go see, you at Norton or, that shouldn't be the case. Like if we can bring in devices, technology, reliable connectivity to do it in a secure way, people want to stay in their house. They're comfortable. Infectious disease, hospital-borne infections are a real thing. Like if we can start treating folks in their home, get that kind of true continuity of care in the home through devices and technology, we should be investing in that. There should be government grants to make that happen. Just because I live in, rural state, whatever, you should still have access. I mean, healthcare should be more of just I was talking to Rebecca Love, and I loved her quote that she said, we're going to see this democratization of healthcare. And that's where we need to go.
Yeah.
Because for all the reasons, the really sick folks who have just not been able to go to the doctor or hospital because they've got 2 kids and they're working, they've got all these things and they can't take the time.
Yeah.
That's what's costing the health system all this money. You know better than I do. And they're coming
all the things you could prevent that end up being a tragedy that then has devastating impacts
and the ripple effects
beyond just one person.
It's I know I'm sounding kind of hopium, but we can do this. Like
It's doable.
We have all the tools. That's why I'm excited to be at Verizon, because we can enable a lot of what's going on, and coupled with folks like Ali and Rashid at iCheck and other awesome innovators that are coming up with these capabilities. We just need to do it.
Right. And you mentioned government grants, but not all grants have to come from the government or even an institution.
Yep.
Maybe some billionaire's ex-wife needs to throw $1 billion at something to try to save the world. Maybe they'll listen to this episode and they'll be like, you know what? That's probably what I need to invest in for a sustainable impact.
Yeah.
And so that's one of my non-secret goals for this podcast, is to put out the priorities of what can have the biggest impact. It's not necessarily building a new wing on a hospital that has somebody's name on it.
Yeah.
Maybe it's burying internet cables under the ground so that people can have access, or throwing satellites up into space in order to give those people access. So thank you for what you're doing to push the needle forward. And I really appreciate getting to know you, Robin.
It's great to be here, Rosa. Keep doing what you're doing.
Thanks. So if you have enjoyed this episode of the Nurse Rosa's Insights podcast, please subscribe wherever you're listening. If it's on YouTube and you're watching the video, or on an audio platform. Also, if you would leave me a comment and let me know if you've learned something, or if you know of $1 billion idea that needs to hear the light and be seen in the light of day, please feel free to share. Love to get those messages out there, and I'll see you in the next episode.